Hello, I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers, and today we're tackling a critical topic, the 10 myths about neuropathy you need to stop believing. For those who already know you're dealing with neuropathy, please click on the link below to download my free guide, 5 things you can do today to help your neuropathy, or reach out to book a consult with us. We see so many patients in our clinic misled, delaying care, and letting nerve damage worsen. If you've heard things like neuropathy is just part of aging or there is no hope, this video is for you. Over the next 10-12 minutes, we'll bust these myths wide open, share the truth based on science and our experience, and give you practical steps to take charge of your nerve health. Stay with us. This could clear up confusion and change the game for you or someone you care about. Before we dive in, some lawyer talk. Please consult a healthcare professional for any issues you may have. This is not personal healthcare advice and is for informational purposes only. Let's set the stage on why these myths matter. Peripheral neuropathy happens when the nerves outside your brain and spinal cord, your peripheral nervous system, get damaged. These nerves are like your body's wiring, carrying signals for sensation, movement, and autonomic functions like digestion or sweating. When they're compromised, it's like static on a phone call, causing symptoms like tingling, numbness, or pain. Common causes like diabetes, vitamin deficiencies like B12, infections, autoimmune conditions, or injuries like repetitive strain. Misinformation can keep people from acting early, and we've seen patients suffer because they believe the wrong things. To be upfront, not every neuropathy case fits the textbook, but busting these myths can empower you to seek help. Let's get started. Myth number 1. The damage to your nerves is the same as the severity of your symptoms. I'll be frank, when I first started treating neuropathy, this was what I sort of believed. As I saw more patients, it became clear that circulation and blood sugar levels were better indicators to nerve damage in response to treatment. Now we use cutting-edge technology called pseudoscan in our office to measure nerve damage directly. It's fantastic because it predicts treatment response with amazing accuracy. We had one patient with horrible pain, but pseudoscan showed he had minimal nerve damage. 12 weeks after starting care, he was a new man. This has been great for patients because we're able to be much more realistic with how long it will take to progress in treatment and make sure we're not overtreating or worse, undertreating. Myth number 2, neuropathy will go away on its own. Please don't fall into the maybe it will get better on its own trap. Neuropathy is progressive, worsening without treatment. We've had patients wait years hoping symptoms wouldn't fade, only to face severe pain or mobility loss. One patient's untreated tingling led to foot ulcers he didn't feel. Early action, like controlling blood sugar or addressing deficiencies, can slow progression. Don't wait. Track symptoms and see a doctor for tests to prevent complications. The most concerning part is that neuropathy typically progresses slowly, which means you may not notice changes and then get used to a new normal. If you look back 3 years and see a different person than you see today, what do you think will happen in another 3 years? Myth number 3, only people with diabetes get neuropathy. This myth is so common and it's dangerous because it stops non-diabetics from getting help. Diabetes is a leading cause. About 60% of diabetics develop neuropathy, but it's not the only one. Vitamin deficiencies, alcohol, chemotherapy, infections like Lyme disease, HIV, or repetitive strain can trigger it. There is some worrying research showing that glucose tolerance issues, pre-diabetes, can cause neuropathy before full-blown diabetes. We've seen a few patients in this situation that leads me to believe this is the case with some people. Don't rule out neuropathy if you're not diabetic. Keep a journal and ask your doctor for blood tests to explore all causes. Myth number 4, neuropathy symptoms are always painful. Not true. Many think neuropathy means burning or stabbing pain, but it can be numbness, tingling, or no sensation at all. Different nerves carry different signals, and each person's body reacts uniquely. Some patients come to us shocked they didn't feel a foot cut or notice constant cold feet. That's neuropathy too. One patient ignored leg numbness until he started tripping, and tests showed advanced damage. Check your skin daily for injuries and see a doctor for nerve tests. Don't wait for pain to act. Myth number 5, there's nothing you can do about neuropathy. This one breaks my heart, and we hear it way too often, but it's so far from the truth. While neuropathy isn't always curable, it can often be managed or improved with early action. We use non-invasive treatments like nutritional support, class 4 medical cold laser therapy, neurobiofeedback, and shockwave therapy, to name a few. One patient, Dawn, couldn't walk far due to foot pain, but got back to daily walks and even got a dog. You can see her link in the testimonial below. Lifestyle changes like blood sugar control or B12 supplements help too. If you're told just live with it, get a second opinion. Track symptoms and ask about drug-free options. Myth number 6, you'll always know if you have neuropathy. Not always. Some cases are silent, especially early on. You might notice subtle changes like dropping things or dry skin on your feet, regardless of how much lotion, without obvious symptoms. We had a patient who didn't realize her balance issues were neuropathy until a fall brought her to us. Tests showed undiagnosed diabetes. I've noticed that early balance problems often show up in the shower, especially when closing your eyes to wash your hair. Not quite sure why. Check your feet daily for cracks or hair loss and see a doctor if anything seems off, even without pain. Myth number 7, neuropathy symptoms are the same for everyone. Far from it. Neuropathy varies widely. Some feel burning, others numbness, some just weakness or balance issues. It depends on whether sensory, motor, or autonomic nerves are affected. We've seen patients with different symptoms, one with hand cramps, another with foot numbness, both neuropathy. Don't dismiss unusual symptoms. Track changes in a journal. Myth number 8, medications are the only way to treat neuropathy. This is probably the most dangerous myth of all. Medications may help pain, but they don't address the cause, and many patients need more pills with less relief. Does that sound like it's fixing the problem? We use non-invasive therapies like neurobiofeedback, class 4 medical cold laser, and shockwave therapy. One patient cut her pain meds after our treatments improved her foot sensation. Lifestyle changes like exercise or diet also help. Ask about drug-free options and log what affects her symptoms. What can even be more concerning about this is that some patients being put on one medication after another. We had a patient come in for a consult earlier this week who was on a witch's brew and was really starting to affect her mind and even her kidneys. Myth number 9, neuropathy is a normal part of aging. Patients often think tingling or numbness in their hands or feet is just getting old. But that's not true. Aging might increase risks like diabetes or poor circulation, but neuropathy isn't inevitable. It's caused by specific issues like high blood sugar or B12 deficiency. We had a patient in her 70s who ignored leg tingling for years, blaming age, until tests showed treatable circulation issues. For more on circulation, see our video, Why Neuropathy Symptoms Worsen at Night, linked below. Track symptoms in a journal. Note if they're worse at night, a circulation clue, and see a doctor to find the cause. Myth number 10, you can't prevent neuropathy. Not always true. While some causes like genetics are out of your control, many are preventable. Managing diabetes, eating nutrient-rich foods, avoiding excessive alcohol, and preventing injuries lower your risk. Monitor your diet and lifestyle, and ask for screenings like blood tests to catch issues early. There you have it. The 10 myths are about neuropathy you need to stop believing, from it's just aging to there's no prevention. These misconceptions can delay care and worsen your health. But now you're armed with the truth. If these myths hit home, don't wait. Start a symptom journal and contact a healthcare professional or neurologist for a full evaluation. Tests like pseudoscan or nerve conduction studies can pinpoint the cause and guide treatment. At Innovative Nerve and Joint Centers, we've helped countless patients manage neuropathy with drug-free, non-invasive approaches like laser therapy and neurobiofeedback. Early action is key. For more health insights, subscribe to our channel and share this video with someone who needs it. If you're questioning neuropathy myths or noticing symptoms, share your story below or contact us to see if we can help. Start taking steps today to take steps tomorrow.